I'm Ryan at WVAES CLINIC. Let's go over some exercises for that lower back. It's all about stretching your hips and toning up your core. When the flexibility of your hips is in balance with the strength of your core, your lower back's gonna feel a lot better. Just think your lower back sits in between your big rib cage, all the weight that's above that, and your hips. So your hips provide a foundation. We want that foundation to be level. If it's sitting like this, your spine is just like a tree. It's not going to grow that way. It's going to come up and then come straight. So we want to set that foundation of your hips level so the spine can be straight up and down. We want to have natural curves in there as well, but what we want to watch for is the tone of the core. When people are working all day like this and they're squeezing their shoulders back to stay upright, that's what everybody always says, pull your shoulders back and stay upright. Well, now you're tensing up the muscles of your back instead of your core. So we want to relax that. We want to pull the ribs in. And that's what these exercises are there to help you do. That's going to help your lower back to sit at a better medium in between. So let's get started. Go ahead and lie on your back here. Come down carefully. If your back is hurt, you want to use your elbow and come down. Okay, now just bring your feet in nice and close. Okay, hands on the hips, take a big breath in, try to lift your rib cage, and just give a gentle push of your hips away, just to give your lower back a little bit of space there. By the way, the lower back likes to have a little curve that comes away from the floor. So if you're ever just relaxing and want a little pain relief, you can put a pillow under that little curve there, and that'll help the bones to open up from the disc. Now let's get a little bit of core warm up here. Let's just hug the knees into the chest. Tuck your chin in slightly. Okay, take some slow, deep breaths. See if you can inhale for a count of 3 or 4 like this. And then exhale for about the same speed. Now squeeze your abs more and more and loosen this hold a little bit. So it's more your stomach holding your rib cage off the floor and holding your hips up. See if you can elevate your hips. You see I'm doing that little lift of the hips there. See if you can hold that from the lower stomach. Okay, good. Now let go. Let's bring the arms up. If you can have the flexibility in your hamstrings, stretch your legs up like this, hold them. Stretch like that. If that's too much for you, if your lower back is flared up, you can get enough just like this. And anywhere in between will give you a different level where you can feel that your flexibility is improving and your core is strengthening. What you always want to do, now hold this up while I'm talking to you, keep that ab contraction here. What you always want to do is when you feel pain, let's say you open it up here, oh, that hurts my back. Don't just get out of the exercise and do something else. Just back off a little bit and stay with it. Okay, good. Now just take a second and relax. Take a 15-second rest. Put your hands right here as you rest and practice relaxing in your upper stomach and filling into the diaphragm as you inhale like this. If you do it properly, right at the bottom of the ribs, you should feel them fan out to the sides. That's essential for your lower back feeling good in the long term, is knowing how to control your breath from your diaphragm. Okay, let's do one more contraction this time, just lifting up. Bring your hands behind your head this time. I know some of your neck is already getting tired. Try to lift your hips up and lift your shoulder blades up and just get a sustained contraction there for 30 seconds. Now I've been talking for 15 seconds already, so we're already past the halfway point. Just try to stick it out for a little longer. Try to use your lower stomach to pull your hips off the floor. And you got 5, 4, 3, 2, 1, and relax. Take a 15-second rest. Hands to the diaphragm, try to fill up here. You have to relax in your upper abdomen. Imagine like a Santa Claus belly, like your breath is filling up here. And if you do that properly, you should feel the lungs pull out to the sides. There's the muscles in between the ribs that you have to strengthen that will help your ribs to separate as you breathe, so you can get more oxygen. One more contraction here. We're doing 3 rounds on everything. So just lift your feet. Even if you're right here, just keep your knees really bent if your lower back is really sensitive on these. Lift your head, 30-second hold. You guys got this? Now look at your diaphragm while you hold it. And try to sustain that same way of breathing as you hold an abdominal contraction. So I'm looking at my diaphragm, I want to fill it up right here. I want to see myself getting wide. And then exhale, gently exhale, squeezing the stomach muscles, push every last little bit of air. You want to fill the bottom to top, side to side, and front to back. You should feel your lungs expanding against the floor. And exhale. And relax, that's 30 seconds, good. Hands the diaphragm, try to take 2 breaths like that in your 15-second rest. Just practicing controlling your breathing from the diaphragm. Inhale like this. And exhale. A lot of people just have too much tension in their stomach when they breathe. And they're using all the muscles up here when they breathe. So what happens by the end of the day, they have tons of tension up here and then their lower back hurts because the core isn't supporting their lower back in their breathing, in their speaking, or in their posture. Those three things could all come from your core. And then because of that, all the upper back muscles have to hold them up and has to lift the lungs when they breathe. Let's do the next exercise here. We're going to cross the right ankle at the left knee. So this is my right leg here. I'm just taking the ankle and putting it at the knee. Okay. Now that makes a little hole. So my right leg's coming up. My right hand is reaching through that little hole and grabbing on the knee. Interlace, lean back, and pull it in. Now, if this is too much, you can grab your hamstring. Just open that knee up, grab your hamstring, and pull it in. I'm very flexible. I started doing yoga when I was 13. I started teaching yoga when I was 19. I've been teaching yoga over 20 years now. I've taken several different yoga teacher certifications. So again, this hip stretch for some people can aggravate the lower back if you try to go to the maximum stretch. So I don't ever want you going to the maximum stretch. Okay. By the way, we're holding this stretch for 1 minute and we have just passed 30 seconds. So what I want you to do is just gently increase. If you ever feel, oh, it hurts, just back off 20%. I want you to find the max and then back off 20%. That way you're hanging out around 80% of your total capability. And if your lower back is really flared up, you might just put this foot on a wall and just relax there. Take this hand, push the knee away and pull it in, and you'll get a lot of relief just from doing that hip stretch. Okay, we are at the 1 minute mark. Now we're going to keep the ankle at the knee, hands behind the head, and we're going to turn this into a stomach exercise. So if you're at the wall here, scoot away a little bit. And what we're going to do is, this is the safest way. If your lower back's flared up, just touch down and try to lift your hips. And touch down and lift the hips. What this does is it puts the strength of your stomach against the tension of your hips. So the tension of your hips is going to give you resistance. And we want to bring those two things into balance. You want to have nice and strong core and flexible hips with a good strength supporting them as well. Now we're just doing 30 seconds of these. You have just a couple more to go. Okay, perfect. And let's switch sides. Let that right foot come down. Bring your left ankle to your right knee. So left leg coming over, ankles at the knee. Left arm reaching to. Interlace your fingers on the knee. Make sure you interlace them nice and good. If you just are like this, you're always going to feel like you're slipping off. And don't let this foot be up here. Pull it down so it's nice and firm in there. Okay, get a good hold on your knee. Again, if that's too much, you can grab your hamstring. Just lean back now. Try to fill up into that diaphragm. Don't get lazy on the diaphragm control. Stay focused here. You should be expanding out. Exhale. Some part of it in the beginning, just let that exhale naturally happen. But then towards the end, I want you to squeeze the diaphragm in enough to push out every last bit of that stale air. That'll give you more space in your lungs to fill up completely. Now breathe in again. We're just stretching for 1 minute here. You passed the 30-second mark, so stay with me. Exhale fully. Try to control that inhale for 3 or 4 seconds. Breathe in. And exhale. One more breath at that speed. Breathe in slow. Bottom to top. And exhale. Squeeze the core at the end. Hands behind the head. Let's begin our leg lifts. 30 seconds. Just touch down and lift up. And touch down and lift. Inhale on the way down. Breathe in, and then exhale, you squeeze the core and press up. Ideally, your shoulder blades should be off the floor, okay? Touch down, inhale. Exhale, lift. Inhale, exhale. So I want to do a little crunch from the bottom and the top. You're trying to elevate the hips. Just a couple more. A lot of people have strong cores, but they have a two-pack. They get the upper abs really strong and their lower abs are weak because they never lift the legs. They get on their back, they do stuff like this. You've got to work the lower half of your core by moving your legs around. Last one. Okay, perfect. And got it down. Give yourself 15 seconds to rest. Hands to the diaphragm and practice breathing into this place. Push your belly up like a hill. Up at the top. See if your lungs can fan out to the sides. Now push it all out. One more breath like that. And exhale. Okay, now one more thing that I love to do for the lower back. Rotation can be a sensitive thing if there is a disc issue involved in the lower back pain. So if you have a disc issue, a herniated disc, a bulging disc, very dehydrated discs, you want to be very gentle with rotation. But I find that since the hips tense up and they rotate, the lower back has a lot of rotating pressure on it, and thus it relieves a lot of pain to stretch it in rotation. Okay, but watch the degree at which you rotate if you have a history of disc injuries. And again, you can check in with your doctor, your physical therapist, your chiropractor on this. Just keep your knees together and slowly go to the sides. Now, if you're getting pain here, just back off a little bit and hold it right there. I want you to have a nice, gentle stretch. If you don't have any history of disc issues, go to the floor. You can even kick that front leg out longer to give you a lever. This arm should be stretched up, pull it right back and slightly upwards, okay? And then you want to turn your head towards that thumb so your whole spine has that uniform rotation. Look up with the thumb. And let's do the other side. Rotate, kick it over, gentle pull, hands up, and look at your thumb. See how I'm taking the back of my head and I'm scooting it over towards my shoulder, and then I'm twisting. That has a way of lining up the articulating pillars in your neck. Like the thumb there, just give a gentle pull as long as it feels okay for your lower back. Let's do each side one more time with a little bit more brevity, a little more quickness to it. Go to the right, inhale, put it in your belly, and release. Go to the left, inhale. Look how I'm doing a little arch in my lower back as I go. That opens up the space where the nerve exits the spine there. Okay, and let's go to the center. Now we're gonna do a little short work for the obliques. The obliques help you to rotate in their action, but they also help you to brace in your core. When your posture, when you're doing sport, I've seen a lot of athletes that had a strong core. You could see their six pack, but when I would test their obliques, they were much weaker than the rectus abdominis, the six pack muscles. So we want our obliques to be really, really strong because they're huge muscles. They wrap all the way around. So we're gonna bring our arms out, legs up. Now, I taught this to a 76-year-old woman that had really bad arthritis, and she could do it. So a lot of you are already saying, oh, I don't know if I can do obliques. Look, just go a little bit to the side, pull this rib towards this hip. Just pull that in a diagonal. Go to the other side, this rib coming towards opposite hip, pull it in. And you want to have a sort of a lifting of the hips as you do this. You're coming back, I'm lifting the hip, come back, press up. Okay, look straight up and down. Now, bending the knees makes it very easy on the lower back. If your lower back is feeling pretty okay today, and your core is relatively toned, you can make this harder on yourself by doing it with straight legs. Flex the feet and go all the way to the side. Now, it's not just one or the other. You can be any degree in between, okay? So this is the easiest. Even here, you're gonna feel more resistance than just having your knees totally flaccid, okay? Let's go side. Now, what I want you to do is connect the breathing with the movement. So inhale to the side, exhale to the center. Inhale to the side, exhale to the center. Just a couple more times. Breathe in, try to lift the hips in the middle, lift the hips, and breathe in, lift the hips. And you can kick your legs out long and try to bring them up towards your hands and come back. If your legs are extended here, you can try to float your hips as you go back through the center. I like to try to bring my toes over my face. That's getting a lot more advanced. One more time on each side. Now this time we're gonna hold it on the right, take a little stretch, breathe in. Other side, breathe in. Come up, lift, embrace. And relax. Hands to the hips, bring your feet in nice and close. Just give a really gentle push to scoot your hips away from your rib cage. Try to open up that space between your ribs and your lower back. And the last thing we're gonna do is a bridge. So you're just going to drive your heels down, drive the balls of your feet down, and lift up. You wanna lift to where you feel the glutes contract. Now, this is, the way that we look at it is that the glutes are a part of the core. So when I say core, I'm talking about everything between here to here, everything really, the glutes, the upper quads and hips, the whole abdomen, the obliques, the serratus anterior, and the latissimus dorsi. To me, that's all core. So if I'm saying core, I'm talking about everything basically between your hips and shoulders, that gluteus maximus. Every fitness trainer, every yoga teacher, every personal trainer, they all know we got to get people's glutes engaging because today people spend way too much time sitting. Go ahead and relax. Take a big breath. Pushed back up. We spend so much time sitting, those glutes don't contract. So you have to drive your heels down, squeeze your knees in towards each other, press the balls of your feet down, and lift to the point where you feel the glutes contract. Because if you don't focus on that, it's going to be all quads and you're going to look like this. The quads are always the most dominant part below the hips. We want to train the hamstrings and the glutes to be comparable to that so that we have balance within this wheel of strength in the lower body. So you gotta drive down and get those glutes to contract. Try to drive a straight line between your knees to your shoulders. And relax down. Okay, great. That was about 1.5 minutes of bridges. Now the best thing to do is to work with positions like that and take it really slow in terms of expectations of holding it for the maximum time. Just lift up and hold it and then relax down. Then lift up and hold it and relax down. Same thing when you're doing abdominal work. A lot of people completely avoid core work, but it's really important for the lower back. So you just have to start where you're at. And my motto is regularity over intensity. So I don't want you thinking that intensity is going to get you anywhere if you're going to do that twice a week. What's much better is to do a couple bursts, 20 minutes in the morning, 20 minutes in the afternoon, be really consistent every day. Even if that was 5 to 10 minutes, it's going to make a difference. More so than if you were to go on Tuesday and work really hard and be super sore, and then go back on Thursday or Friday and work out really hard and be super sore and do nothing in between. Your back is still going to hurt. Okay, so again, I'm Ryan for WVAES Clinic. I broke my back at 17 years old, so I developed a lot of spinal rehab techniques on my own. Later, I took yoga teacher training, personal training. I just completed chiropractic college, and I realized over 20 years of experience that the things that I used to rehab myself really do work for other people. You should always check in with a doctor, a chiropractor, a physical therapist to make sure these exercises are safe for you. You can check out our website, WVAESclinic.com, and check it out. We have Telefit there where you can meet with me one-on-one no matter where you're at. And soon we're going to have a whole video series for you that is going to be built for strengthening, meditation, and rehabilitation. Thanks for watching and have a great day.